So we did a survey of families with known Fabry disease and asked them for the patients in the family that were still children, what age of onset did they have first symptoms? For the girls in that, it was about age 9, with the earliest onset being as young as age 2. There are some patients who don't become symptomatic until late adolescence or even adulthood. And the first symptom is usually pain, but can also be gastrointestinal distress, which can be abdominal pain, recurrent diarrhea, or in some patients, nausea and vomiting. The severity of the pain and or the GI disease tends to increase with time, at least until adulthood. Then going into their 30s, 40s, and 50s, women will have increasing difficulties with fatigue, sometimes shortness of breath, and then developing heart failure. They have at any given age a significant increased risk for stroke. We have less information about how that changes over time because stroke is something that comes out of the blue and we don't have a lot of ability to detect changes prior to the actual events. The kidney disease has kind of a 2 peaks presentation. There's a group of women who will present very much like the typical male presentation of Fabry disease, and they will have early onset progressive kidney disease. The next group is women who present with the typical female presentation, often will not go into early renal failure, but their renal reserve is still decreased, so they are at increased risk to develop renal insufficiency going into their 60s and 70s. And that will be significantly higher than the risk for the general population.